Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I would like to talk to you about ADHD, which is attention deficit hyperactivity disorder, and gender dysphoria. Specifically, I would like to talk to you about the fact how often people get misdiagnosed by having ADHD when in reality what they were having are clusters of symptoms manifesting from gender dysphoria that may on the surface look like ADHD. Having said that, it is very possible for people to have ADHD as a standalone diagnosis. And in order for you to really find out whether what you may be experiencing is standalone diagnosis is to get properly evaluated for it. However, I have also seen a lot of people who think they have ADHD, who have been misdiagnosed with ADHD, when in reality, what really is happening is that they're experiencing gender dysphoria, and on the surface, it looks very much like ADHD. Remember, I've done a lot of videos talking about how social anxiety is one of the other things that gets misdiagnosed. And once people start taking care of their gender dysphoria, social anxiety tends to go away. Another is just generalized anxiety, depression, as well as some other things that are happening to individuals. It is very common to misdiagnose things. Psychology, just in general, is a complex field. To properly derive a diagnosis sometimes takes either somebody who's very experienced and specialized in that particular diagnosis, or somebody who has done a proper job of evaluating individuals. And when you have gender dysphoria, it's easy to get things very confusing and having them overlap with other things. So here's the thing. One of the reasons why some of the manifestations of gender dysphoria gets misdiagnosed as ADHD is because, and let me read it off, I just left just common symptoms, is because symptoms on the surface, if I read them to you, they sound very much what people with gender dysphoria experience. And if your gender dysphoria is more severe, you're going to experience it that much more. Some of the symptoms are behavioral, for example, aggression, excitability, impulsivity, irritability, lack of restraint, or persistent repetition of words or actions. Cognitive symptoms that are absent-mindedness, difficulty focusing, forgetfulness, problem paying attention, or short attention span. Mood problems, anger, anxiety, boredom, excitement, or mood swings. Now, I don't know about you, but in all of the clients I work with, I can name numerous of these items of this list that they also have experienced because they're struggling with gender dysphoria. Now, some of the people have asked me, why is it that so many symptoms that people experience on the surface start to look like ADHD symptoms? One of the reasons being is because when you are struggling with gender dysphoria, what happens is, whether you're aware or not, your brain is devoting a huge amount of its energy and huge amount of its storage. Think of your brain as software. And think about, or maybe hardware, probably how bad I am with computers, probably hardware would be best way to say it. Think of your brain as a hardware. As a hardware, it devotes X amount of space for certain things. You have space for when you're productive and you're focused, you have space for solving problems, you have space for something else. But when you're struggling with gender dysphoria, what happens is that it starts to occupy at least 80% of your brain capacity. And whether you're aware or not, and depending on the severity of your gender dysphoria, subconsciously, your brain is going to be working on overdrive in order to try to solve the problem of gender dysphoria, or in order to minimize the symptoms you feel, in order to devote a lot of energy figuring out what is your coping strategy. Your brain is going to operate at 80% capacity or more. So what do you think is going to happen to the rest 20%? Now, let's say you have work to do, or you have something else to do, and you have to now focus on your work, you have to focus on some other task at hand. But because you only have 20%, you're not going to be as productive. Because you only have 20%, you're also going to experience all of the other things: forgetfulness, aggression, mood swings, irritability, walking into places and forgetting why you ended up there, Reason being, again, is because your brain is not using its full capacity to help you focus on this particular task, because so much of its activity is being devoted to trying to solve or trying to control or trying to mitigate or trying to strategize how to cope with gender dysphoria. This is a problem. This is why people sometimes appear very absent-minded when they're sitting across somebody and they're talking and they're listening and they think they're being present, but in the back of their head, they're thinking about their gender dysphoria, whether they're aware of it or not. A lot of our things, a lot of our processes tend to happen subconsciously too. So don't underestimate how much bandwidth, if you will, how much storage capacity gender dysphoria takes within your brain. And when it takes that much capacity, that's when you start having all these other symptoms: depression and anxiety and irritability and social anxiety. And yes, when you go to see a therapist and you are presenting your life story without really digging deep into whether you might have gender dysphoria, I can totally understand how a therapist will say, wow, this really sounds like ADHD. You have such hard time concentrating. You're having all of these cognitive issues. You're having all of this behavioral issues. You're having all of these psychological issues. Or, gee, wow, you also have social anxiety. I can see it's so difficult for you to go out in public or to be out around social individuals without really linking what is it about being out that bothers you? What is it about inability to focus? What is it? Is that of asking you, what is your brain being preoccupied with? Is it possible that your brain is utilizing tremendous amount of energy trying to solve something else? And if so, what is it that your brain trying to solve? This type of questions help you open up a dialogue in terms of trying to figure out what else might be going on a deeper level. Again, some people may have ADHD as a standalone diagnosis for sure. For a lot of other individuals, it is very highly possible, not possible, highly probable that what's happening may look like ADHD, but really it is gender dysphoria. And if you are aware that you already have gender dysphoria and on the surface everything looks like ADHD and you're having a hard time concentrating, ask yourself, are you actually in a period of your life where you are focusing on starting to manage your gender dysphoria, not by coping skills, but actually doing something about it? I see again and again people who are starting to do something about their gender dysphoria. Either they decide to transition, either they decide just to start hormones, either they decide just talking about it, or they just decide to make peace with it, whatever it is they decide to do. Oftentimes, what happens is that 80% of the brain that was occupied suddenly becomes freed up. Why? Because you made peace with it. In one way or another, you made peace with it. Either you made peace with it because you decided to just accept it and realize you're not going to do anything about it and move on, or because you decided to take life into your control and actually go through some elements of transition, if that is for you. But that decision unblocks that 80% of energy, because your brain doesn't have to solve the problem anymore, because now you're actively doing something about it. Then people become suddenly more focused, more present. Their even dissociation tends to go away because now they can be more grounded within themselves. So if you're somebody who feels like you might have ADHD and also gender dysphoria, and you're working with a therapist, or maybe you're just wondering if you may have too, it may be very highly probable that you just may be having standalone gender dysphoria. Gender dysphoria is I always call it a beast. It's just such a monster that it's able to really affect you in so many different aspects and so many different functioning areas of your life that are so essential to survival. And that's the devastating thing about gender dysphoria. So keep in mind that if you think you may have both, you may probably have just one. If you're really wondering if you have ADHD and it's starting to really interfere with your productivity, your work, make sure you are at least properly diagnosed with it versus just having a few sessions and somebody claims that you do have it. Because again, the symptoms all look so similar on the surface, so you have to be careful to distinguish between the two. Comment below, let me know if you are struggling with this, or if you're somebody who thought you had ADHD, but it turned out you have gender dysphoria. Especially comment below, let me know if your all of this bandwidth, 80% of bandwidth that was occupying your brain suddenly got freed up, and you started to focus better, and you started to just be present better once you started to do something about your gender dysphoria. Comment below, love reading all of your comments, and I will see you all next time. Bye.